Hi, my name is Alexis Rivas, and I'll be giving you a report on room 559. They are a 4-year-old male with no known drug allergies. Mom is in the room with him. Past medical history is dysphagia, aspiration, past use of a feeding tube, preterm birth, so those two kind of go together, and dental crisis. Chief complaint would be mycoplasma pneumonia, walking pneumonia, and rhinovirus. They came in on 11/1, so they haven't been here that long. Last set of vitals I took were a heart rate of 82, respiration of 20, temperature of 97.7, which is great from what it was. It used to be 103, so it's coming down. Blood pressure of 129/70, MAP of 95, O2 of 97, which is pretty good for pneumonia. And on a pain scale, the FACES scale, he used his finger to point to what he was feeling, was a 0 out of 10, which is great. All assessments were normal from the head to toe. The heat, head normal cephalic, everything's symmetrical and present. Neuro level of consciousness was present to person, place, and time, so that's great. All cranial nerves were innervated. Cardiac, regular rate and rhythm with no bruise. +2 on all of the pulses bilaterally, and a cap refill less than 2 seconds. GI and GU, he can use the bathroom by himself. Feces and urine, all normal there. And upon palpation, there was no masses, and the bowel sounds were intermittent clicks and gurgles, normal active, and the abdominal contour was soft, non-distended. Skin was the normal color for a Caucasian male. Condition, it was all good throughout, no bruising, rashes, edema, signs of infection, none of that. The musculoskeletal system was great. He had great movement, range of motion, muscle tone was fine all throughout. Push-pull test was great, +5 on that. Posture was good for him. He was sitting in the bed, eating breakfast, watching TV, so that's fine, but I did get to see him walk a little bit, and his gait was steady, which was awesome, and he's able to perform all the ADLs that a typical 4-year-old can. The only section that for me was a little iffy was his respiratory. He was breathing at a normal rate, and his rhythm of breathing was fine, but it's just when I was listening to him breathe, there were faint intermittent crackles and congestion upon auscultation of the bilateral bottom 2 lobes, which he does have pneumonia, so that is to be expected. But I did want to note that that's still there. It's much better than when he first came in, but we are still hearing a little bit of congestion and crackling. He has a 22 in the left upper arm, peripheral IV. It has a transparent tegaderm that is intact, and there's no signs of infection or infiltration, and it's patent. It pulls and pushes meds, so that is awesome. Like I said before, Mom's there, but she said that he has been using the bathroom regularly. No problems there. Like I said before, the feces and urine, all normal color, normal consistency, everything good there. There's no critical labs at the moment, but his x-ray did show that there was a little bit of whiteout on the bottom 2 lobes, which is consistent with pneumonia. So there is still that, and he is taking amoxicillin 2 times a day for the pneumonia, and he is getting IV fluids. The doctor was talking about changing the milligrams of the dose, so I would check the MAR and see what he changed it to. There's no new orders other than that. They're all pretty timely. and he is on isolation precaution because of the pneumonia and the rhinovirus. So make sure you're wearing your gloves and your gown and the mask, all that good stuff. We are working on, coughing and the deep breathing, having the head of bed up so it's easier for him to cough and get all that secretions out. We're working on being hydrated as well. Mom knows all of this, and we're all kind of working together to get all that crud up for him. And I would just make sure that when you go in, you would assess, his breathing, like I said before, and just take a new set of vitals just to make sure that they're, close in range and nothing is drastically changed. But other than that, that's all for room 559.